Come on. That's my good boy. Come on. So this is Maddox, and he came to us a couple of years ago as a rescue. Whenever he first came to us, he had some serious health issues, including really bad heart disease, terrible secondary lung disease, and he was skin and bones. He also had really bad chronic diarrhea that we just couldn't seem to fix. So after we got him into relatively good health, and we still couldn't resolve his diarrhea or put any weight back on him, we started to think maybe there was something else going on. So we tested him for a disease called Exocrine Pancreatic Insufficiency, or EPI, and he ended up having that disease. So once we got him feeling better, we ended up keeping him in the family, and we haven't looked back since. So that's our Maddie. So today's episode is going to cover EPI, or Exocrine Pancreatic Insufficiency. Let's roll that intro. Hello everyone, Dr. Rhett here, and today's episode is going to be on exocrine pancreatic insufficiency. So I guess the first thing we need to do before addressing what exocrine pancreatic insufficiency is just to very briefly recap what the pancreas is and what the pancreas's jobs are. I'll just briefly retouch on that because I actually have an episode regarding pancreatitis which goes through the anatomy of the pancreas a little bit more, and I'll leave a link to that in the description below if you want to go check that out. But very briefly, the pancreas has basically two major jobs. One of those jobs is to make insulin and glucagon in order to maintain glucose homeostasis in the body. And the second job of the pancreas is to make digestive enzymes so that whenever we take in a meal, the pancreas releases these digestive enzymes into the small intestine so that we can digest and absorb whatever we eat. So that being said, exocrine pancreatic insufficiency basically means that for some reason the pancreas is not making and releasing these digestive enzymes. The result of that is that we can't absorb the nutrients that we take in, and so you wind up having a patient that has chronic weight loss even though they have a really good appetite and really bad, intractable, horrible smelling diarrhea. That's actually kind of a silly description. What diarrhea doesn't smell horrible? But hey, that's medicine for you, right? Now, there are two basic ways that a patient can wind up with exocrine pancreatic insufficiency. I'm going to call it EPI from now on because that's a mouthful to say. Some patients are just born with a problem with the pancreas. We call that a congenital disorder. This can affect both dogs and cats, but it's more common in dogs, and the most common dog breed to have congenital EPI is German Shepherds. EPI can also develop secondary to some other primary issue, such as severe trauma, chronic pancreatitis, or pancreatic cancer. If that is the case, then there's also a chance that that pancreatic damage could lead to diabetes as well. The most common clinical sign that you're going to find in a patient that may have EPI is going to be chronic weight loss even though they have a really good appetite. They may also have chronic loose foul-smelling stools. The patient will also show clinical signs of malnutrition such as poor hair coat, poor skin, poor muscle development, things like that. And that's because without those pancreatic enzymes, we can't absorb the nutrients that we take in. And the food that we eat passes through us largely undigested. So how do you diagnose EPI? Well, the most reliable diagnostic test is something called TLI, and that stands for trypsin-like immunoreactivity concentration. So it's likely that your veterinarian is going to want to pull some blood work and send it out to test for this. When we test for TLI, it's also very common that we wind up running a blood panel that includes things like TLI, something else called PLI, and then cobalamin and folate. If your pet is older and showing signs of EPI, then there's a very good chance your veterinarian is going to want to do further diagnostics in order to try to rule out chronic pancreatitis or cancer. Now, EPI isn't the only thing that can cause these clinical signs. So if the EPI test comes back negative and you can rule out EPI, then your veterinarian is probably going to have a pretty serious discussion with you about further diagnostic tests such as something called a diarrhea PCR or something even as serious as exploratory surgery so your veterinarian can take biopsies of the GI tract. If your pet does wind up having EPI, this is a very fixable, manageable disease. It's not something that you're going to be able to cure. They're always going to have this problem. But treatment is as simple as providing your pet with those digestive enzymes that they can't make on their own. And luckily, they manufacture this in a powder-like form that you can apply to your pet's food. And it's that simple. Now, if your pet's EPI is caused by some other secondary problem, that treatment may be much more difficult because you have to first address the primary problem. In Maddox's case, once we got him on the digestive enzymes, everything started correcting. He put on weight, his diarrhea resolved, and he's a happy, healthy boy. And if I had to hazard a guess, I would think that he was probably initially abandoned because he started having these chronic wasting issues, and the owner either didn't want to bring him to the veterinarian to run these tests or thought that he had something serious that couldn't be fixed. But I could be wrong about that. The point is, no matter how serious you think your pet's condition may be, no matter how bad they look on the outside, it may be something that's perfectly fixable. And yeah, sometimes you may have to invest a little bit of money in the proper diagnostics, but if you do that, your veterinarian's going to have a much better chance of finding the right diagnosis and the proper treatment. In Maddie's case, he looked like he wasn't going to live much longer, and he probably wasn't because of his condition, but it was a very easily fixable condition. So that's exocrine pancreatic insufficiency in a nutshell. If you have any questions about this disease, or if you would like me to address any other topics, please feel free to drop them in the comments below, and I'll make sure to address them. Otherwise, we'll see you in the next video. Take care.